A toothache is not fun, and it never happens at a convenient time. I've often joked with patients that it seems to happen the closer you get to an event or the further you get from my office. If you or someone you care about is dealing with a toothache, I'm sure you'd like to figure out how to deal with it as quickly as possible. Well, I'm here to give you some tips on how to get through it. Hi, I'm Dr. Ryan. Welcome back to the channel. I'm a licensed dentist in the US. I'm here to help educate patients on their oral health and to improve communication between patients and their dentists. Today's video is primarily aimed at patients, although new dentists and new hygienists and assistants, anyone new to the profession, might find this information to be useful as well. Okay, first we'll get into some basics about getting ready for your visit to the dentist for your toothache issue. First, I'm going to say right up front that if you're having a toothache, you should absolutely see a licensed dental professional. The following advice is intended to get you started in the right direction so that you can get the most out of your visit. And although I'm primarily talking about toothaches, you can pretty much apply this information I'm going to give to you to other facial pain issues as well. I'm not going to talk about tooth sensitivity today. It's a whole different topic. I'm sure we'll make a video about that at some point. Also, over-the-counter medications might be helpful, but I'm not going to be giving direct advice on what to take for medical, ethical, and legal reasons. When you see your dentist, please bring a list of your medications that you're taking with you when you see the dentist. Medication names are crazy difficult to remember. If you have them written down, it's a massive benefit. Yeah, we really appreciate that when you do it. Trying to remember them off the top of your head is so hard. So just write them down, bring them with you when you see your dentist. Also, since pain in your mouth, your head, or in your neck could be coming from something besides a tooth, it's probably a good idea to start seeing your dentist if it seems to be coming from a tooth, but realize that other doctors may need to be getting involved and be open to any recommendations that your dentist has to refer you to somebody else. All right, so now we're going to go over some specific information which is tremendously useful for you to bring with you when you go to your dentist to talk to them about this toothache. So the first category is going to be what we call onset. You need to be able to tell the dentist, when did it start, how long ago, was there an event, was there some kind of specific thing that happened that made the pain begin? Let them know that. That's what we call onset. Also, what makes the pain worse or what makes it better? That's what category we would call palliate and provoke. So what provokes it? As it would be hot, cold, chewing pressure, or sweets. And does anything make it feel better, like over-the-counter pain medications? Or weirdly enough, does drinking something cold make it feel better? That's all useful information as well. Also, it's tremendously helpful to try to describe the quality of the pain as best you can. If you can have any descriptor when you come in to talk about your toothache pain with the dentist, that's a huge help. Saying that you feel something or that it feels different is a good starting point, and I'll have patients come in and often say that, and yeah, that's a great place to start, but we need more information to figure out what's going on. So here we're going to talk about the quality of the pain. Do you have like a dull pain or a sharp pain? Do you experience a burning sensation from whatever is causing the trouble? Or is it like an electrical feeling in your mouth? Try to figure out some kind of descriptive terms you can use to explain to your doctor, your dentist, what you're feeling. Just saying that you feel it or something is there doesn't help us help you. All right, now this next category actually can be tricky. The region of the pain, where it's coming from. In the early stages, it can be difficult to pinpoint exactly where it's coming from, but as best you can, try to figure out where that pain originates. And when you get to the doctor's office, use like one finger, just point to where it is that pain's coming from. Don't stick your fingers in your mouth. That's usually not helpful because then we can't understand what you're saying. Also, it's not very helpful to try to point to it with your tongue. You may feel like you're being very precise with where you're pointing to with your tongue because the tongue has just great proprioception. The tongue can feel something very precise and your brain interprets it as like, oh, I'm being really specific with where I'm telling the dentist where I'm pointing at, but the tongue is large. It's kind of like laying a big old Christmas ham on top of the table. And when you point to something with your tongue, you're actually covering like 3 or 4 teeth at once, and we don't know which one you're actually pointing to. So use just a single finger, point to it, and say that's where it seems to be coming from. Also, as I was saying, sometimes it's difficult to pinpoint where the pain is coming from, especially in the early stages of a toothache. So don't get too frustrated. Do your best to kind of explain it's upper, lower, left, right, and that's kind of a good place to start as well. And there have been situations where I've had patients come in with toothaches and we have a hard time figuring out exactly where it's from. And then we wait like a day or two, Maybe I've sent them to a specialist to have them look at it more closely. And within a day or two, all of a sudden they wake up and they're like, oh, it's exactly this one. All of a sudden it zeroes in on exactly which tooth it is. So that can happen. Be patient if that's the situation. Also, it's really helpful to tell your dentist if you feel the pain radiating to somewhere else. And this is a weird experience that you may have where you get what's called referred pain, where the pain is actually coming from one spot, but you feel it more in a different spot. And so if you feel like something else is hurting, maybe it's your ear, maybe it's your joint, maybe it's a muscle, you feel like the pain's there. So you may have to do some investigation and figure out maybe that's the secondary side of the pain, and the actual original side of the pain where the source of the problem is, maybe is a tooth. So that may take some investigation on the part of your dentist. So be patient with that and realize that could be happening as well. Okay, next category is severity. How bad does it hurt? When it's at its absolute worst, what would you rank it on a scale of 1 to 10? Keep in mind 10 is like horrible, excruciating pain, like you're being burned alive. 1 is like very, very minor. So when it's at its worst, try to think in your mind, what would I rank this? And then you can tell your dentist that when you go see them for the toothache. Also pay attention, it may come and go. So when it's at the least amount of pain that you're having, make a note of what that is too on that scale of 1 to 10. Then you can report that information to your dentist. And that's what we would call severity. Okay, what time of day is it worse? Is it worse in the morning? Is it worse at night? Is it worse right after you chew something? Is there any kind of thing that you can explain when it is at its worst to the dentist? This is what we call the time category. And how long has it been going on? Has it gotten worse as time has gone by, or has it gotten better as time has gone by? Explain to your dentist like how it fits in that category. Now you may have noticed that the categories I used to describe the toothache had a pattern, OPQRST. For those of you watching this who are clinicians or hoping to be clinicians, this is a handy mnemonic to help you have that conversation with patients about this, and it helps you remember these questions that you need to ask your patients. I've seen it a few times from different sources, but for the sake of crediting someone, I definitely didn't come up with this myself, but for the sake of giving somebody credit, I am happy to give credit to Dr. Jamison Spencer, the founder of the Spencer Study Club, and he's an excellent clinician in the treatment of TMD and facial pain. If you ever get a chance to hear him speak, I would absolutely encourage you to attend one of his lectures. So once the problem is identified, your dentist can establish a plan. Be patient. Sometimes a diagnosis can be tricky, like we were just saying, as far as how it can change over a few days. Possible problems do include a crack in the tooth. You could have a large cavity, which is impacting the health of the nerve in the tooth. You could have gum disease. You could have an infected tooth, or some type of other pathology following a procedure, such as you could have a dry socket, which is what happens sometimes after you have a tooth pulled. Possible solutions or treatments may include a root canal, extraction of said tooth, or if the problem is due to gum disease, you might need some type of gum treatment, the most common being what we call scaling or root planing. That's what some people call deep cleaning, and that's where you kind of go below the gum line and clean that bacteria off of the root of the tooth so that the source of the problem can be resolved. So other things could be causing your pain apart from a tooth, and that's what we call nonodontogenic pain. It's pain in the face or mouth not related to the teeth. This could be TMJ related pain. It could be sinus or ear infection problems. It could be a viral problem, a fungal infection. It could be a neurological issue. It could even be a heart attack. It has been documented that symptoms of a heart attack can radiate to other parts of your body. Signs of a heart attack can include pain in the chest, as well as pain in the back, the arm, or even the jaw. The VIRGO study was published in 2018 in the journal Circulation. VIRGO stands for Variation in Recovery, the Role of Gender on Outcomes of Young AMI Patients, AMI being acute myocardial infarction. These researchers went to 103 U.S. hospitals and interviewed 2,009 women, 976 men who were there receiving treatment for an acute myocardial infarction. This was a cross-sectional study, which in the world of research is not ironclad, but this is often how we gather information in healthcare to better understand diseases. And in this case, they interviewed a lot of people, so this large amount of data reassures us that we can draw some good conclusions. They asked these patients about the symptoms they experienced. 87% of women and 89.5% of men experienced chest pain. More than half of both groups also had 3 or more additional symptoms, like pain in the back, the arm, the jaw, or the neck. although this was more common in women. A quick note, I don't mean to come across as ignoring various sexual orientations. I'm just going by the verbiage, the language that we used in the study itself. So just want to be clear on that. Furthermore, Dr. Daniel E. Myers published an article in the Journal of the American Dental Association in 2022. Dr. Myers expanded on this concept. He pointed out that more and more case studies over the years have reported patients who had pain in the face or the mouth due to conditions that were present in the chest, the throat, the lungs, or the upper GI tract. The range of conditions included the myocardial infarction that we already mentioned, as well as angina, pericarditis, aortic dissection, Takayasu arteritis, thoracic tumors, esophageal cancer, hiatal hernia, GERD, and keratodynia, among others. I should say that Dr. Myers made the point that many of his sources were case studies. We don't know the rate at which some of these conditions refer pain to the face and mouth, but it's something we should take into account and something that really requires more study. I am not saying all this to freak everybody out. If you think you have pain in your mouth due to a tooth problem, absolutely schedule a visit with your dentist. However, if they do not find a clear explanation for the pain inside of your mouth, if they recommend that you go to the ER or see your physician, please take them seriously. Also, dentists and anybody new to the dental profession, please keep in mind that a patient may be experiencing orofacial pain originating from somewhere other than their mouth. You'll want to consider that in your differential diagnosis. If the patient in your chair is also complaining of dizziness, weakness, shortness of breath, and/or pain in the chest, back, or arm, then you should activate 911 and begin following your medical emergency protocols. The bottom line is that we should all be aware that if pain in the jaw cannot be attributed to an exact tooth or a joint problem, it could be pain from a heart attack or another type of medical issue. Thank you so much for visiting my channel. I hope this video helped you get prepared for a visit with your dentist in the event you have a toothache. I'd love for you not to have a toothache at all, but they're pretty common, unfortunately. If you have comments or questions, be sure to leave them below. Also, give me suggestions on topics you'd like me to discuss in the future. I've got a lot of ideas myself, but hey, I love to hear any ideas you guys have. Please share the videos with friends. Hit the like button, subscribe, all the good YouTube stuff. I'll look forward to seeing you next week. And remember, smiles are contagious.